Welcome back. We have another episode of the Injury Report here from Mobility Doc Sports Network. I'm your host, Dr. John. Wasn't expecting to be back so soon, unfortunately. One of the Eagles linebackers who's been having one heck of a year, Nakobe suffered a torn patellar tendon this past week against the Packers. So it's good to be back. I hope you're all happy to see me. Quick little update. I mentioned last time how I was going to be playing for third place. Fun fact, I won. So Maggie officially has no reason to taunt me because of fantasy football. Every other reason is still there. But anyways, enough about that. Getting into Nakobe Dean. We're going to be taking a little bit of a deep dive today into what it exactly means for him, not only in his current recovery period and what that protocol will kind of look like for a torn patellar tendon, but also breaking down the outcomes and what it looks like, what can happen for previous players that have gone through this injury and have returned to the field. So let's get right into it. So your patellar tendon is exactly what it sounds like. It's a tendon that runs from your patella down to your tibia. Specifically, it attaches onto your tibial tubercle. And this is a continuation of that quad tendon where your quads come in, they attach to patella, and then the patellar tendon runs from that patella to the tibia. So this tendon is very, very important for knee extension, right, which is what the quads do, as well as providing some of that stability of the knee specifically to that patella. So while we call it the patellar tendon, what we consider a tendon is typically something that attaches muscle to bone. A ligament is something that connects bone to bone. So sometimes this tendon can also be referred to as the patellar ligament. Regardless, the way that this tendon/ligament is, I'm going to continue to say tendon, is typically injured is through a couple of different ways. One, which is the most common, is when you have a fall or direct trauma to the front of that knee directly onto that tendon. The other way is when you're jumping, you're landing, and your knee continues to bend while that foot is planted. So what ends up happening is that tendon is then pulled and stretched while trying to provide stability and continue to do its job and slow down the movement towards the ground. And ends up being too much, and then it ruptures. If it is just a tear through the entire tendon, what can happen is that there can also be an avulsion of the tip of that patella, and that piece of bone comes off. Typically, if there isn't any tendonitis involved previously, then what can happen is that more often than not, the tendon is torn closer to the base of that patella. If there was tendonitis involved previously that the player was managing prior to the injury, then typically the tear is actually somewhere in the middle of that tendon rather than closer to the patella. Obviously, I'm not sure where Dean's tear is. I'm not even sure if it's a full tear, but we're going to be operating under the fact that it is a full tear as he's out for the playoffs for the rest of the season. So if it is a full tear, surgery is then required to then reattach the tendon and allow that chain to then become full again so that you can extend your knee. What they'll do in the surgery is not only reattach the tendon to the patella, or if it was in the middle, reattach both ends of the tendon, but they'll also make sure that the patella is then positioned properly within the patellofemoral groove of your knee. What can happen before surgery, if the tendon is fully torn, is that when you do try to use your quads, what ends up happening is that your patella will actually come up out of that groove a little bit and up closer to the top of your knee because there's no longer any resistance from that patellar tendon to keep it in place. So they'll make sure that the tension of the tendon is appropriate and matches that uninjured side, as well as making sure that the patella is relocated and in the best spot. Rehab-wise, the first 2 weeks is similar to a lot of other knee surgeries or other injuries that we've talked about so far on this podcast, where your focus is going to be reducing pain, reducing swelling, reducing inflammation. They'll be doing some exercises like heel slides passively, not actively yet. You can use a towel and slide, things like quad sets, glute sets, ankle pumps, things to get blood continue moving, get some of that fluid out, and ultimately try and prevent other issues like blood clots and DVTs. They will place the knee in a locked hinge brace. In rare cases, they'll use a continuous long rigid brace, but for the most part, it'll be a hinged brace that's locked into 0 degrees of knee extension. The patient can walk with as much weight on that leg as they can tolerate pain-wise, provided that that brace stays locked into 0 degrees of knee extension. They'll also be given crutches or some other assistive device to help with walking. Progressively over the next couple of weeks, weeks 2 to 6, you're going to be continuing to work on passive range of motion, working towards full weight bearing. The goal is to have full weight bearing around that 6-week mark with that brace still fully locked. In weeks 6 to 15, that's when you start to increase not only what the patient is doing as far as range of motion, they're not bringing in active range of motion, but you're also going to start to give some range in that brace available. When they're walking, it should still be locked, but what they can do then is if they're at home, they're laying down, they can unlock the brace and possibly even off, but making sure that the brace does not go beyond what the current range of motion ability is. And what they'll typically do for range of motion is slowly increase over the course of several weeks, roughly maybe 10 degrees at a time. But that all depends on the protocol and a specific surgeon to surgeon, and depends on the technique of the surgery itself. Usually around that 4 to 6 week mark, you're beginning to do some sport specific training, some plyometric activities, some light jogging, things of that nature, as well as strengthening to start to return to their sport or activity. For most sports, you're looking around an 8 to 9 month time frame before you're back on the field, court, whatever it might be. Sometimes up to a year. For football, you're looking closer to that year mark because of how high impact, how explosive, and how much contact there is in that sport itself. That all depends on a multitude of factors, as well as the outcomes of the patient's or athlete's recovery post-surgery. Depends on a multitude of factors such as age, fitness level prior to not only the injury, but then also prior to surgery. Have they had previous surgeries before? There's a bunch of different factors that end up impacting how they're able to return to sport. Overall, though, there are very good outcomes for patients being able to return to their sport and play at a similar or same level as they were at before. Obviously, the higher the level that you play, it might be a little bit more difficult to get back to where you were. But if there's any cartilage damage, any ligamentous, other ligamentous damage, or anything else that might complicate the surgery, or something else that has to heal, that then does have a decrease in positive outcomes as far as your ability to return to play. And it's usually less of your ability to get back to the sport, but more so how well you play when you're back in your sport or activity. The most common deficit is knee extension strength, which makes sense with how that patellar tendon is directly responsible for working with the quads and the quad tendon to be able to extend your knee. So Nakobe Dean, if he is going through surgery, which seems like it is his reality, unfortunately, then he certainly has a little bit of a road to recovery, but he is still very young. He's 24 years old, I believe. He'll turn 25 this season, or next season technically, but he's young. He's obviously in good shape. If he plays in the NFL, I would hope that he is. But he was having a great season. I expect that he is going to be able to come back with little to no deficits or issues for an Eagles defense that has been at the top, if not the very top and best in the league this season so far. So not great news for the team, the Dean, or Philly fans in general for the current moment. But in the long run, I expect him to be the same player that he was before, running sideline to sideline and making big plays and blowing up opposing offenses' schemes. So that's a little bit of a dive into a torn patellar tendon. As always, make sure you like, comment, and subscribe to make sure you keep up to date with these things. It'll be something like this where I kind of pop up every once in a while, maybe every 2 weeks or so, talking about some injuries. It might be football related, it might not, but obviously we're in the midst of the NFL playoffs, so here we are. Hopefully there's no more injuries and I'm able to report on more positive things, but appreciate you guys tuning in and enjoy the rest of the playoffs.